exercise. So that is what I want to do, real world evidence. This is the clinic that we have. And this is a concept that we launched in 2016. This is called the International Diabetes Education Day. And my dear ladies and gentlemen, this year, the IDF has recognized, I think Dr. Gupta was there in that meeting with Andrew Boulton, they have recognized this as the World Diabetes Education Day. So diabetes education has to be a separate entity brought into the integration of diabetes management. So we are doing it. These are the things that we got in for this Meta clinic. In fact, the ex-president, no more, was our president, a beloved friend, a patient, and a well-wisher for 5 years. This is the time that we spend for our patients, 0.02. And, less than half a day for a person with diabetes on the entire year. And these are our doctors. The patient coming with a phone on his shoulder, and the doctor is looking at some data, and he will spend less than 2 minutes. If possible, maximum is 2.3 minutes overall. I'm talking about public-private sector. And, figures are as abysmal in Bangladesh and Pakistan. So what we need is we need to do these things. We need to monitor people. We need to tell them the basics of diabetes management. We need to do the meal planning, tell them the exercises. If you have a right-sided knee osteoarthritis, we have to actually tell him what he should not do or should do. We have to make sure that he's living well with diabetes. The life transitions, puberty, marriage, pregnancy, etc., we have to tell him certain new things. We have to prevent his complications or deal with the complications in this setting. Finally, we have to form a connecting link between doctor and the patient. And this is the overall ambit. I'm talking about diabetes educators, podiatrists, everyone, the psychological counselors, all come into the picture. For need of integration, people talk about reimbursement. And, for that, they give 10 hours of education for the first month and then 4 hours, the next 2 months. This is how they do it. They do it in the US. But who pays for us? And we keep on thinking, and then the thinking becomes a burden. Tell me and I forget. Teach me and I remember. Involve me and I learn. Benjamin Franklin, old man. But what is now being said by Edgar Dale is these. These are the data. 10% what you read, you remember. 20%. So we know about all this. What you need is you need the education for patient benefits. These are the benefits you accrue. Finally, the health cost become lowers. And this is a poor country somewhere. The active participation is important. Self-management education is important. The self-efficacy, the understanding in the pyramid of Maslow's hierarchy of needs that I am self-empowered. That's something which will give you the drive to do well. And this come from your support room, your friends, your relatives, your colleagues. It can come with particular diabetes coaching that we do, and we have the telephonic follow-up, etc. And on the modern gadgets now, WhatsApp, etc., can come into play, the technologies. These are the methods by which we do it, and this is a kind of a conversation map where I think every person who practices diabetes should kind of draw or make a conversation map, basically kind of culturally speaking, likened to that culture, to that food habit, to that particular setting, right? So these are the kind of food maps. These are the kind of an integrated support, the collaborative approach, the knowledge, the skills, the behavior that the person should learn. It has to be patient-centered. And the support that you give as a doctor or an educator to reinforce, to a coach, to have a peer community helping you out, and overall the health outcome, you have to look, you have to gauge, you have to measure the outcomes. These are the recommendations I will not touch. They all keep on saying that self-management education is important with self-management support. And of course, people with diabetes, they don't follow through the referral. If you ask them to come 2 months later, they will come perhaps when they have lost their vision. So they are initially emotionally so upset, they're so shocked with the diagnosis of diabetes that they're stunned and they go to hunt other doctors who are saying some good words for him, apparently good words to hear. They end up relying on family, the quacks, the friends, somewhere the whole cycle is disrupted. And as providers, we know that the education is important, but we hardly have time, we hardly refer, and we hardly encourage people's attendance. So as the demands, in COVID days, the practice is escalating, we need to balance, to enable the patients to help themselves, and also balance the priorities and the goals. The diabetic educators can step in and help. Doctors will get the help from the education to improve the patient outcomes, delay the onset of diabetes and complications, track and monitor the patient's progress, increase efficiency, and of course, pay for the performance and the quality of improvement, the PDCA score. The patients can benefit from these self-management skills, blood glucose control, lipid control, blood pressure control, cardiometabolic renal, all the continuum, the identification of where he stands, and finally, he gets to live happily thereafter like the king and queen story. And the role of the diabetes educator, we have a burning example of the, we have identified, we can acknowledge Dr. Kavita Gupta as one of the finest educators in the country. She was, awarded by the organization which I have in Calcutta as obviously the best DE in the country. So the role is the education of diabetes and the skills associated with it. You have to become a consultant for, you to own that feeling that I'm a consultant and I know I'm the best and I can do the best for the patient. And you have to have the sense of accountability for your own patient, looking into the behavior change, the application of the behavior changes in his or her life. You have to give him constantly emotional support. And when you talk about these healthy lifestyle management issues, which are not very easy and good to digest initially. And you have to also make awareness for preventing complications. Finally, you have to be the best link, the buddy, the angel who connects the doctor and the patient. So these are the things, whether you monitor, whether it's a glucometer, whether it's a sensor, whatever. This is your record. This is what you have to keep. You have to align your, identification of these numbers with the literacy background, the numeracy background of the patient, and the food habit, and the style that the patient is following. You have to constantly harp the patient to do good words, empower the patient, and you have to keep records every time. The record management is very, very important. Real life and ideal practice, what happens? Real life is always different from ideal practice. But when ideal practice actually overlaps the real life, becomes real life, then what you best get is the dynamic education. And these are the people, the mission of the diabetes care providers. You have to cross-train like a doctor. You have to constantly keep on training yourselves, coming to these conferences, talk to people, cross-training, get credentials for your other disciplines. And, as a diabetologist, you need to know your neurology, cardiology, nephrology, every logy, whether it's a dermatology, all the logies possible. So as a complete medicine man, who else but a diabetes practitioner? So you have to get, the best quality of understanding to give the best quality of care. And for an educator, she has to actually be the central resource of all the available data and, juggle between me and my patient. And that's her role. She is the manager at home, she is manager at the hospital by clinic, and she is the overall manager in this world. So that is her role. I mean, I completely now have dedicated my life to the cause for making that particular bench of people, the baby of these beautiful ladies, to actually rule the country or rule the world of diabetes with a help. So they have everything. They have knowledge, they have everything, but what they don't still have is the access that we should give them, unfortunately. So we have to plan. We have to plan where it is theory. We have to plan how to help them to help us. And we have to prepare. Without preparation, nothing, no plans happen. And this is the empowered patient. He actually self-actualizes where he is. He understands that this is giving him satisfaction. His self-efficacy goes up, his adherence goes up, his dropout from the clinics or, wherever he shows, falls, and he improves his quality of life. He achieves long-term glycemic stability or whatever other BP stability, lipid stability, and reduces the onset of progression of diabetic complications. And finally, as I said, like the kings and queen, they will live happily thereafter. Now, this is very important. We talk so much, but what is happening? Somebody is hearing. This is from my dear Trisha Dunning's slide. I actually regard still as my sister. She passed away on 18th October, this October. So it's not even 1 month, so I'm still in bereavement. I'm very close to the family as well. And this lady heard that the doctor said to exercise and eat the right foods. The other lady, similar words, so the doctor, he said, exercise, that is, go to the shop, make merry, and buy new shoes. So this is, people will not remember what you did. People will, they will not remember what you said. They will remember what you made them feel, actually. So you don't have to tell them. Make them that they're getting the right thing in the right place. And this is that famous movie. Can you tell me the movie? The Dead Poet Society, right? This is that respectful relationship of learning, the patient, the educator, and the doctor. That camaraderie, that doctor is not a god, or the educator is not the only angel. It's this, all of them together makes life extraordinary. So these gaps can be narrowed by one common language, one simple thinking, one aspiration. The goal is we are going to do good to all of us. And this is our conference. The conference, you see, the theme was time to pair up with diabetes educator. And we started this in 2017. We continued till last year. And This was Anand, the patient. That is Sneha, the educator. And the doctor was Sevabrat. So I don't bring in doctor because being a doctor, it's no point talking about. So key message is the education is more than words. It is underpinned by science. And it requires a respectful partnership in the messages that are being tailored to that individual's physical, psychological, spiritual, and emotional status. Teaching that is not working, and you are getting numbers of people, dying in 6 seconds, 7 seconds, 8 seconds, you're missing something somewhere. So please revise. Bring the educators in front. Let us follow them. So this is what I said. Give them the power, and they will give you greater responsibility. Similarly, this is my real life story. My educator, my daughter, Kiran, who has now migrated, it's not even 7 days, to Africa to take care of these, perhaps, Jaima's grace, these type 1 children. They're very poor. And when we went to Africa, we thought that they perhaps need help. So perhaps Jaima has sent her to that place. And this is what we believe in. She believes in skills, competence, resource, inventiveness, proficiency, training. She designed this concept, and we started this first diabetes educator conference. We started this award also for the first time in India. So the teacher, if he is indeed wise, does not bid you to enter his house of wisdom, but leads you to the threshold of your own mind. So you start thinking. And of course, we know this. The person with diabetes who knows the most lives the longest. Education is the most powerful weapon which we can use to change the world. Who said? Nelson Mandela. And what do you and I say? You and I say, of course, the world of diabetes, you and me. This is my last slide, my slide which obviously brings emotional some attachment. Rest in peace, my Didi, Trisha Dunning, the queen, the mother of diabetes education. Let us take a pledge to fulfill her mission. I'm holding that, the International Diabetes Educators Day, that logo. Thank you. Thank you.